I'm his father.
I'm the son.
I'm Bob Rakel, Professor Emeritus at Baylor College of Medicine in Houston, and started editing the textbook of family medicine back in, well, it's called the Textbook of Family Practice at that time, back in 1971. We're now in our 8th edition. The name has changed as the specialty's name changed to Textbook of Family Medicine. And since I'm getting old, I talked my son into being co-editor of the 8th edition. And so hopefully people will continue buying it, even though I am a young man involved. Because I have a young man involved now, is up to date and a lot more on the ball than I am.
I'm Dave Rakel. I'm Associate Professor at the University of Wisconsin Department of Family Medicine in Madison, Wisconsin.
This book is available entirely on the web. In fact, not only entirely on the web, on the internet, but there is a good deal of material that can be put onto the internet that would not fit into the limitations of the printed text. So in addition to what's printed here, each chapter usually has some additional material that can be placed on the internet, plus 30 videotapes on procedures, anything else. Those are the main things. But if you have an iPhone, an iPad, a computer, you can access all of this information very readily on the internet.
And also, I think it honors both the subspecialist and the super generalist well. You know, as family docs, we're super generalists. We understand how complex systems interact, and so that's relationship-centered care. But we also need tools. We need guidelines based on the evidence to help us put action to our wisdom. And how can we take the wisdom of the patient and that relationship and really understand what that person needs to be well, to get their disease under control. I think this book does a really good job of honoring that complexity while giving specific tools for what the clinician can do right after reading it to bring that into the patient care. I remember when I was 6 and the first edition of this book was all over our table tennis table.
That's right.
And to be able to be a part of the 8th edition and to hopefully honor one of the leaders in our field and keeping this going and seeing it really adapt into the future of how we access information to help improve our care of our patients is going to be a really exciting thing to see where the next edition and that subsequent edition may bring us.
Another aspect of this textbook, I think, is that it's of value to the other specialists in medicine, not just primary care, but especially physicians in other disciplines that weren't trained in this comprehensive nature of medicine, that yet are seeing patients and being forced to practice and see primary care type patients. So this is a good reference for them. It's not just for family physicians. Nurse practitioners use it very effectively, but also surgeons, any doctors seeing a patient that could be a primary care patient, I think, can benefit from what's in this book. A famous case that I like to refer to was a person that came that had a headache. And they said, well, I need a neurologist to treat my headache. They went to a neurologist who said, I can't find a reason for your headache. And so sent her to a neurosurgeon who found no reason for the headache. And then she finally went back to her family physician who knew her well and said, it's the stress you're under. And he gave her treatment for the stress, which completely eradicated the headache. So it's our patients choosing to go to the subspecialist, sometimes inappropriately, and hopefully helping those subspecialists understand what it is we're about. Because with a serious inadequacy of primary care physicians in this country, other specialists will have to be doing primary care. And this is one of the references that we think will help them in areas that they were not adequately trained.